My name's Claire Judge. So I'm a sclerotherapy nurse, and I've been a sclerotherapy nurse for the past 23 years. They're blue veins, but they don't bulge. So as long as they're associated with smaller thread veins, then I'm happy to treat them. But if they're anything too big, then it's out of my remit. I've got a website. I get a lot of patients that are referred from other patients. GPs know about me. And because I work in hospitals, I get referrals from other consultants as well. Laser's very effective from the chest upwards, but it doesn't work on legs. It's just not powerful enough to get the deeper feeding veins. So I would have a very good rapport with our laser clinic up at the Royal Free, and they treat all the heads and shoulders, and they refer me all their legs, and that's the way it seems to work best. It's excellent. It's got a really good result. It's not perfect, there isn't a perfect treatment, but it's a very effective treatment to help people improve their confidence and have their legs looking better. It really varies on the patient. If they've got an awful lot of veins, then I may not be able to treat them all in one session, so they can come twice in quite close succession. If they've got smaller numbers, then they can come, have them all treated in one session, and then usually they have the choice themselves. If they want to come back for a second session, I can top up what they've done. Otherwise, they wait till they've grown a few more, make it worth their while, and come back in a couple of years. No, the drug I use is a detergent-based drug. It's been around since the 50s. It's very, very safe. It's also very effective. It's called polydocanol, which is the active drug. The drug I use is called etoxysclerol, and it's been around for a very long time. It's very effective. If you've got larger veins, I think it's a better option. It does help the result, in my opinion. The side effects all tend to be fairly transient. It's a very safe drug, like I said, so you can get brown marks on your legs, but they tend to go over a period of months. And sometimes you can get a few lumps and tender bits, which is just where you've got a little bit of blood trapped in the vein, waiting to be absorbed, and it can take time for that to settle down. But everybody has my phone number, and if they're worried about stuff, they just give me a call, and that helps. I think I'm different because I tend to work in hospitals. I think it's far safer for patients and for me. I like the fact that there's doctors and other people around rather than working in my garage or, a beauty therapy salon. And I'm, been around for a long time, so I've seen most legs, and I have good working relationships with consultants. So if I'm not happy, then I'll just send them off to be seen by a consultant, and then at a later date, once their big veins are fixed, they can come back and I'll treat the little ones. I'm basically working in the south of England. I've got a clinic at Mackindale Surgical Centre, which is based in East Grinstead. I also work in Woking, which is in Surrey, and I've got a clinic up at the Royal Free Hospital, so that's in North London, and they have an outreach private clinic which is up in Hadley Wood.